Welcome to Heart Healthy Living with Dr. Jackie, a Big Blend radio podcast that features Dr. Jacqueline Eubany, a board-certified cardiologist and electrophysiologist and author of the best-selling book, Women and Heart Disease, The Real Story. So welcome, everyone. Always having fun here on Big Blend Radio with Dr. Jackie Eubany, who is a board-certified cardiologist and electrophysiologist and taught me how to say the word electrophysiologist. And she's about to teach us more words today, talking about heart health. September is, and I'll see if I can get this, Peripheral Artery Disease Awareness Month and Vascular Disease Awareness Month. And I think they're connected, right, Dr. Jackie? Welcome back.
Thanks for having me. Yes, they are connected.
Okay. So peripheral sounds to me like it's like a vision thing. So when I saw peripheral, I thought it was an eye thing. And I think that's why we've never talked about this on the show, because I always thought peripheral vision, but that's not the case.
So in this case, peripheral just means outside, like outside of the heart. So anything outside of the heart is peripheral to the heart. So when you're talking about peripheral vascular disease, you're talking about arteries outside of the heart, and more specifically in the extremities is when is what we're referring to.
So that would be more like our legs and arms and things like that?
Yes, that's correct.
So is this like we're having heart disease in our legs? Like, I mean, how does it affect, because we always talk about lungs and around the heart. How does it go to our legs?
Yeah, so it's the same, blood vessels supply the heart with the oxygen and nutrients that it needs to function normally. This same blood supply also supplies all the organ systems in our body, and our peripheral, like our legs and our arms, so that we are able to do our normal function. So as with a heart attack, the pathophysiology or the cause of a heart attack is when these blood vessels become occluded or blocked. And when you don't get blood and oxygen to the organ system that it supplies, then the tissue dies and causes the symptoms of, in the case of a heart attack, it causes the symptoms of chest pains and shortness of breath. Now, when you have this in the leg, the blood vessels get occluded or blocked. You don't get blood and oxygen flowing to your extremities, and this can cause pain. And this is what peripheral vascular disease is. And it is a harbinger of heart disease. So if you have peripheral vascular disease, meaning that you have blockages in your legs, then you also most likely have blockages in your heart.
Ooh. So and if you don't treat peripheral vascular disease, it is going to result in heart disease, right? So this is one of those warning signs like diabetes, right?
Yeah, it could mean that you should get screened for it because you most likely have concomitant heart disease. And yeah, getting treated for it early is always good.
So this is kind of connected to diabetes, isn't it?
Yeah, diabetes is considered a risk factor because diabetes causes damages to your blood vessels. So having diabetes puts you at risk not only for heart attacks, it also puts you at risk for the peripheral vascular disease because it's the same blood vessels. Diabetes affects the blood vessels in the heart, in the legs, everywhere, the whole body.
Yeah, I know. I've had friends who, the diabetes route, it actually led to amputation.
Yes, absolutely. So if it gets really bad, you may need your extremities amputated.
Wow. Okay, so we need to not, like, I just like Googled this and I'm hearing now like smoking again. We keep going back to this.
Yes.
But smoking is one of the biggest problems for our extremities, our legs and arms. I wouldn't have thought that. I would have thought, okay, just our lungs and our heart, not just. But I didn't realize it's actually affecting your legs too.
Yeah, so smoking is one of the big risk factors for peripheral vascular disease, just like heart attack. So it's the same pathophysiology or the same cause. Blockages in the arteries and the organ system's not receiving the oxygen that it needs. So smoking can cause arterial narrowing, and can cause problems in the vascular system, whether it be in the heart, in the brain, in the extremities. So yeah, smoking is a big risk factor for this.
Now, I know last month we talked about, the youth getting more, the rates going up for youth in heart disease, which is scary. Stroke, heart disease, obesity is a big issue, and for so many reasons, right?
Yes.
And then your word of the month was stent. And so now reading like people need stents in their legs for this.
Yes. So if the blood vessels becomes narrow to the point where you're not getting enough oxygen to your legs, you can actually require an amputation if your leg dies. So putting stents in there to open up the blood vessels so that you can reestablish blood flow is how you treat the peripheral vascular disease.
Oh boy. Wow. And this is what, more than 3 million cases per year in the United States. Okay. So
Yes,
this is a
absolutely.
big deal.
It is a
That's
big
not,
deal.
wow. Okay. So I want to go back to this leg pain. Is this like the leg is just in constant pain, or are those like those cramps that people get if they don't drink enough water? Because I've had
No,
those and now I'm scared.
no, it's a pain and cramping when you walk. So it
Oh,
happens when you walk, but when you stop, it gets better. And that's because when you walk, you need more blood flow and more oxygen. And with the blood vessels being narrow, you can't get enough oxygen to the legs, so you get pain. So we call this, there's actually a medical term for it. It's called intermittent claudication. So
whoa.
that's when you have pain with walking that gets better with rest. And that is a sign of peripheral vascular disease.
Wow, you got another term in here today. See, that was a big one too. I'm not going to repeat that. Heck no. But then, because I've always noticed that with like patients coming out, like maybe from a stroke, heart disease, that they can't walk that well, or they take like little steps. And I always thought it was about the breathing because I've, years ago really went through asthma. And I remember walking was a big deal. It was because my body was having a hard time with oxygen. And then the breathing, not being able to breathe, really hurts your body. I mean, it's exhausting. It's the worst thing I've ever been through is this not breathing thing. And it was just like a kind of a temporary thing, but I've always had a little bit of that breathing thing from allergies as a kid,
Yeah.
like smoke and all that stuff. And so that it does affect your, and we were just in Central Oregon with all these fires, and that will start to raise up that little asthma kind of reaction. And through meditation and, keeping calm, I'm able to not go into any kind of attack or anything like that. But your body, I can already feel like my body started to be exhausted from this really constant, this breathing thing because it's that oxygen, right?
Yeah, oxygen is very important to the body. If you can't get oxygen into your body, it's really not compatible with life. So, yes, breathing in oxygen is.
Okay, so now going back to your term, say that other one, that big thing again about like if you can't walk.
It's called intermittent claudication. So pain in your legs or cramping when you walk that gets better when you stop.
Okay.
And it's just,
Claudication.
yeah.
It sounds like an album title, actually. Vacation. Vacation. All right. No, wait, I tried it. Okay. I don't want it, but I tried to
No, you
pronounce it.
don't want it.
No, I don't. But what I do want to know is like, is this related to people getting blood clots? I think I told you once a really close friend of mine died like young in his maybe late 30s, early 40s in the shower. He had the flu, went and took a shower, and he had a blood clot in his leg or something. I don't know how it went down, but he had a blood clot and died. Boom, right there. And it's just hard for Nancy and I to still even think that exists. So can clots, like people talk about blood clot in the leg or something like that, is that related to this?
Well, blood clots can cause peripheral vascular disease, but not all blood clots lead to peripheral vascular disease. So in your friend's case, dying from a clot in his leg most likely reflects the fact that the clot ended up migrating into the lungs and causing strain on the heart and the lungs, which then caused him to pass away right away. But blood clots can lead to peripheral vascular disease. Peripheral vascular disease is more of a chronic kind of thing. Whereas, when you get a blood clot, most of the time it's an acute problem, as it happens because whether it's triggered by some kind of trauma or being sedentary for a prolonged period of time when you have a lot of risk factors. So you can have the acute phase of the blood clot, and then there's some people who are at risk for blood clots and continue to get blood clots, and they have it on a more chronic basis, and that can lead to the peripheral vascular disease.
No, okay, we know smoking is out, y'all. Like that, just
Yes.
So any Dr. Jackie episode, know that it's a no, just a no. It's a hard no.
Smoking is bad for you 100%. It's bad on every single organ system in your body. It can lead to
Wow.
cancer, heart disease, peripheral, name it. Smoking is just not good for you.
And that includes vaping.
Yes, and
Just
that
saying.
includes. Yeah.
So this can really not be a fun thing to get in. We don't want this, right? And then some who are dealing with this, 3 million are going through pain, and this is just not a fun life. And heart disease is not fun. I mean, none of this is fun. But now, obviously, we always talk about prevention, not smoking, healthy diet, walking,
Yes.
So
The
if you have
same
this,
thing. Yeah.
can you walk? Can you walk even if it hurts? Would you recommend that people do take gentle, calm, little bits of walking?
Well, if you're having claudication, you'll probably have it. The narrowing is probably very severe, and at this point, you definitely need medical therapy before you should be released to full on exercise, because they need to open up that artery, because or it can lead to tissue death and amputation and things like that. So if you're getting to the point where you're feeling these cramps, you need to go see the doctor and have the therapy started so that we don't get to the end stage of this, which is where you might need an amputation.
So tissue death is like actual gangrene, right?
Yeah, it can be. Yeah, exactly.
Okay. All right. So can we talk about food now? Okay, you're going to say no to bacon and sausage for breakfast because it is better breakfast month. In other words, and I think about this because it's back to school time and it's family meals month. It is also childhood obesity awareness month, which I think is really, really important. And I understand how busy it is in the mornings, but maybe Pop-Tarts and sausage aren't always the thing for breakfast. So I wanted to ask you about that. So diet, and especially if you have mobility issues, diet is going to be the first thing we can control, right?
Yes. Yes. We always talk about the heart healthy diet. I mentioned the Mediterranean diet, but yeah, those diets that are focused on, heart health or reduce your risk of, blood vessel problems like peripheral vascular disease, heart attacks by up to 35%. So diet, anything you put in your body is very important in terms of your overall health.
Okay. Now, are we still allowed to have coffee? I mean, because I know I have friends who are saying like if they have a heart issue, they're now on decaf, and I've
Yes.
actually slowed down on it just because people keep saying don't, and I only have one a day now, no more like 3-4 cups. One, is it?
Well, coffee or caffeine and stimulants can exacerbate a particular heart condition, so arrhythmias. So in heart conditions where your heart starts racing, called just arrhythmias in general, fast heartbeat, these tend to be triggered by stimulants like caffeine. So in those particular patients, we tell them to cut back on their caffeine so that their heart is not constantly racing, because it's very uncomfortable.
It's like if you've got the drummer Ginger Baker from Cream in your chest. I'm just saying, Ginger Baker. Like that's how as soon as you said arrhythmia again, my mind went, Ginger Baker's on drums. So coffee is like a stimulant, so that may not be good for you. Eggs. Can we talk about eggs because of Better Breakfast Month? And it's also National Cholesterol Education Month, which we've talked about before on the show. So, the link is in the episode notes to go to Dr. Jackie and get her book, Women. You've got to go there because that's a really good one to get. WomenandHeartDiseaseBook.com, a bestseller, but also a link to the past episodes because we do talk about cholesterol and then there's the low and the high and all this confusing stuff that I'm like, what are you talking about, y'all? And then people, what's up with statins? I want to go back to eggs, but what is this statin thing that people are taking? I have a friend doing that and she actually almost went crippled over it. And I think you have to go to your doctor and check your medications at times, right? But she said it had to do with cholesterol. And now I'm like, where's Dr. Jackie? What is a statin?
Yeah, so cholesterol, I know we had an episode a few times back talking about atherosclerosis and plaque buildup. So high cholesterol can cause plaque buildup in the arteries, and that is a risk factor for both peripheral vascular disease and heart attacks. So you got to watch your cholesterol, because cholesterol is what causes these blockages in the heart, like we talked about, or we likened it to your drain. When your drain gets clogged and you turn on, your faucet and the water is not going through fast enough and you pour in like a Drano to clean it. So statins kind of clean the blood vessels or prevent more plaque from building up so that you can get adequate blood flow and therefore oxygen to your organ systems like the heart and the lower extremity edema. So yeah, so you would treat these conditions with statins, especially if a person has high cholesterol.
Mm. So it's important to go back for your doctor checkups to see if your medication is still working. Because I think she was on this for like a few years, and eventually
Yeah.
your body just goes, okay, we're done with this one now. You need something different. And that was an issue. So, and she was like, then she found out other people. So is it important to be proactive? And I know she moved to new doctors and everything, but is it proactive to look at what you're taking over a long period of time and be patient, as a patient, be proactive and go, is this medication still working for me? Is there a way
Oh,
to check
absolutely.
that kind of thing?
Yeah, absolutely. You should be
Okay.
proactive with your own medical care. After all, you're the one who has to live with your body and live with the consequences of, your
Yeah.
medical condition, your medical condition. So yes, you should be proactive. You should know what your medical history is. You should know what medications you're on. You should make sure you're following up with your doctor. Being proactive benefits you more than anybody else. You should be proactive in your own medical care.
Yeah, I think so. And I think it's also pharmacists help too in understanding that. Sometimes, there's all these warnings about different medications, and do any of us read it or listen to it when it's in a commercial on the
Yeah.
TV, all the warnings? Well, sometimes if you're taking the same thing for a while, I think it's like, okay, let's just check this out, because
Yeah,
our
yeah.
bodies change over time
Yeah,
as
yeah.
we age,
Yeah, yeah. The medications have side effects, and if you feel like you're experiencing any of the side effects, you definitely should talk to your doctor about it.
Mm.
Because there's some side effects that are okay, but then there's some that can be life-threatening. So you need to just report it all to your doctor so you can work with them to come up with the best regimen for you based on how you are reacting to the different medications.
Yeah, it was like an eye-opening thing for all of us. And I think it's important to discuss, because we just keep taking our pills and never thinking about it. And then one day, okay, I don't know what's going on, but it comes up with, if you're on medications, just watch and see how your body's doing and report back, right? Okay,
Yes.
let's go back to sausage, eggs, and bacon for breakfast. A big fry up, Dr. Jackie. I know you've been to England. You know those British breakfasts, steak, egg, and chips, and a fried tomato, a little bit of bacon. What do you think? Is that a heart-healthy breakfast for a better breakfast month?
No, deep fried anything, as we always talk about, is not good for you. You definitely want to stick with healthier stuff like the fruits and the vegetables. I love having fruit for breakfast. Chopped up melons and strawberries, with a little bit of maybe yogurt or something on there. But fried foods are definitely bad for you. I mean, eggs are good. They're protein, but the yolk tends to have high cholesterol. So be careful with the yolk. You always have the option of removing the yolk or just cutting some of it out. If you have cholesterol, if you do have high cholesterol, you should be watching how much egg yolks you consume.
I don't know, it's kind of weird. Like, as Nancy and I both age or mature into fine wine, we both kind of like don't eat eggs maybe once every week or two. Like, our
Okay.
bodies just don't want it. It's kind of a weird thing. And I don't know if I know a few other friends who are like that too. I don't know what it is, but it just like your body says, nah, you got enough. Maybe you ate too much cheese. You can't have that too. I don't know what it is. I'll take cheese over eggs any day. Yeah, that's a bad cholesterol, isn't it?
Yeah. Yeah.
Oh.
Yeah. Yeah. I mean, but in moderation, we tend to just overeat, things. Keeping it in moderation, if it's something that you really like to do, is okay.
Okay. So a little bit here and there. So I'm
Yeah.
glad we brought up eggs because it is important to understand that. And so you could have a egg white omelet or scramble up the egg
Yes.
whites and give the
Yes.
yolks to somebody else or
Oh,
whatever. So this is cool. Very cool, Dr. Jackie. That's a whole eye-opening thing about this peripheral vascular disease. And
mhm.
so I'm really glad we talked about that today, as well as the claudication. That sounds like
Intermittent claudication, yeah. And
intermittent.
I like that we're talking about this because it's the same theme, it's the same risk factors, diabetes, smoking, high cholesterol, and it's the same treatment, lifestyle changes, quit smoking, weight loss, losing weight, eating healthy, managing diabetes. So it's all the same things that we've been talking about. So now we see that all of, the same lifestyle issues can lead to different medical. So the overarching theme of our talks is just healthy lifestyle.
Thanks Thanks for joining us on Big Blend Radio's Heart Healthy Living Show with Dr. Jackie. New episodes air every second Wednesday at 12 p.m. Pacific Standard Time. You can keep up with Dr. Jackie at womenandheartdiseasebook.com. Listen to the shows at bigblendradio.com.